Hello. I'd like to tell you about Option Grid, a tool that makes it easier for patients and clinicians to make good decisions together. Exploring treatment options during clinic visits can be difficult. Take Lucy and her clinician, for example. Lucy just found out she has breast cancer. She is scared and anxious, but musters the courage to ask about treatment. Lucy is surprised to hear she has options, two different ways of operating on the cancer, and that the option that is best for her depends on what matters most to her. In a brief conversation, the clinician tries to cover the key issues as well as learn about what matters most to Lucy. This is tough, so we began looking for a way to make this easier. We had already made a web tool for women in this situation. We noticed the most used part of the website was a treatment comparison table, which listed a few key questions. This gave us the idea of creating a tool that used frequently asked questions as a way to compare treatments using the best possible evidence. When using this tool during clinic visits, we got great feedback from patients and clinicians, so we started building a database of grids for different treatments. Here's one suggested way to use option grids. When a patient asks about treatment, offer them an option grid as a visual tool that quickly compares treatment options. You need first to explain the layout, that there are frequently asked questions that you read across to compare the options. Offer to read it out loud or to give them a few minutes to read it over at their own pace. Hand over the grid and a pen to allow them to highlight information they would like to discuss. While they read, you might do a parallel task, such as completing the patient's notes. Then begin the discussion by asking for questions. Your discussion can be fine-tuned according to what the patients have highlighted on the grid and other major concerns. For example, Lucy's grid looked like this. She was worried about the cancer coming back, but she also didn't want to lose her breast. Using the grid allowed her to say what matters most to her and then compare the options based upon these preferences. At this point, the patient may not yet be able to make a decision, so suggest they take the option grid home to continue the discussion with family and others. Clinicians find that the grids are easy to use, help to standardize information given, and improve patient decision confidence. Quite simply, option grids have been designed to make life easier for both the patient and clinician. Use Google to print free PDFs of the grids or go to www.optiongrids.co.uk.